Good morning. My name is Rylan Mazzarello, and today I'll be practicing celiac disease. So, history and characteristics. Celiac disease was first identified by a Greek physician named Aretaeus of Cappadocia in the 1st century CE. He originally called it Coliakos after the word koelia, which literally means abdomen in Greek. Now, celiac disease is a chronic digestive disorder. Basically, you have it throughout your whole life, which damages the small intestine. And this is triggered by eating foods that contain gluten. Normally, it's mostly in kids, but you can actually get it later on in your life too. It can actually have long-lasting digestive issues, which are very bad in terms of preventing the body from obtaining all necessary nutrients, because you're unable to sort of absorb them due to malabsorption from the mechanism which we will be talking about now. So gliadin, a gluten breakdown product, basically triggers this autoimmune condition. So this basically causes an inflammatory response when the small intestine mucosa is exposed to it, as in this gliadin. So the small intestine mucosa gets inflamed and even destroyed when encountering this gliadin. This leads to multiple problems because this mucosa contains villi and microvilli. These are basically important in increasing the surface area. Basically, they improve the absorption of nutrients. But since these are being destroyed, that means that these small bowel mucosa basically lose the ability to sort of properly absorb nutrients because it obviously has decreased surface area from getting obliterated. So, and we see on the bottom here, healthy is on the left, and on the right is celiac disease. We can see the normal villi and the vitreous atrophy. So it's really bad how celiac disease is in terms of surface area. Is it like the taller and skinny ones have higher surface area as well? So generally, as said earlier, malabsorption basically leads to changes in bowel habits, which mostly aren't good. And the proximal small intestine is also most affected. Okay, so signs and symptoms, mostly symptoms. So first is diarrhea. So to begin on this concept, it's mostly almost all of this is in the gastrointestinal region system. So due to malabsorption, this leads to diarrhea. This is the most common symptom, and it's normally watery or like semi-formed stool. So the person is basically like dehydrated, and this is chronic or even recurrent, so it can come back here and there, which isn't good for like hydration and all. And now is abdominal pain as well. So this occurs sort of with bowel habit changes. It can be really severe. Now next is flatulence, which is basically sort of gases that sort of store up in the large intestine because basically since the villi can't properly absorb the nutrients are sort of just sitting there and waiting to be like sort of going into the large intestine. But the large intestine bacteria actually end up digesting these unabsorbed nutrients, which basically causes a lot of gas to accumulate. And the same thing with distension and bloating. Basically the same thing with the large intestine being negatively affected because the large intestine bacteria causes it to have gas. Next is weight loss. This is basically, as mentioned, this is due to malabsorption. So these are actually very interesting, the further effects of malabsorption of nutrients. I like this because this gives a biological aspect. So first is vitamin B12 deficiency. This basically leads to macrocytic anemia, which is basically when the red blood cells are too large and they're not well developed in terms of oxygen delivery. And in this case of B12, this leads to neurological symptoms and even like fatigue and depression. So next is folate deficiency. This is absorbed normally in the proximal small intestine, but in this case it's unable to. This leads to maculitic anemia as well. And so does iron deficiency, leads to iron deficiency anemia. And the fourth one is also in the proximal region. This leads to lower calcium absorption, and this actually has neurological symptoms. And this is actually connected with vitamin D, because vitamin D though is actually in the end of the small intestine. So, and this is also a fat-soluble vitamin. So these two are actually connected in terms of causing osteoporosis due to their deficiencies. And also there is vitamin K deficiency, which is just like vitamin D, but in this case this is in terms of bleeding. Now next is genes and antibodies associated with celiac disease. So these two basically like predispose you to having celiac. And the first one is the most common one, and actually sort of giving you celiac in a way, HLA-DQ2. Next is also HLA-DQ8, but the first one is actually more likely to give you actually bad stuff. Next is the anti-tissue transglutaminase, anti-TTG, and anti-endomyocele antibody, anti-EMA. So now both of these, anti-TTG and anti-EMA, they're actually both IgA antibodies. And some patients unfortunately have a IgA deficiency. So when you're testing for these antibodies, it's important to actually test for the total immunoglobulin A. And if there's low total IgA, then that means that the anti-TTG, and anti-EMA are both low. And so even if they do have celiac, this leads to a false negative test. So then, you must do an IgG version of them if you are suspicious of such an error. So diagnosis, I kind of already tackled on the first two. So total IgA testing, which is basically what I said earlier, as well as anti-TTG and anti-EMA. Now, so and do total IgG testing if you really suspect a false negative from these two. But the best of all, in my opinion, is that, and most medical experts' opinion, is the endoscopy and intestinal biopsy. The reason for this is basically because it's basically pretty easy to detect just by looking at this, but it's basically you get a tube and it goes down the small intestine. And you see here on the top, there's a normal, and on the bottom is celiac. So basically for celiac, there's crypt hypertrophy. You can sort of see like the round circles that are pretty large, and they're not in the normal one. And also there's villus atrophy, which is basically the outer parts are thinner, as you can see. And celiac is really thin, and the normal is kind of thick. Now, it's also important to know that this must be done when you're doing it basically you have to be doing this when you're actually having the patient on a diet containing gluten. This is because it might not actually be possible to detect the antibodies or even the inflammation in the bowel, because they won't be in what causes it to occur. So associations with celiac disease. So these are all actually autoimmune conditions, so that's a little heads up. So type 1 diabetes, this is basically the liver's being affected here, while the thyroid disease is the thyroid hormone, and this is basically what is associated with metabolism. So that actually goes back all the way to that B12 deficiency I was talking about. So it shows how pretty goodly they're linked. Then there's autoimmune hepatitis, basically hepatitis but autoimmune. So you get inflamed liver. And also for the next two, the next one, primary biliary cirrhosis, that's sort of just scarring of the liver, unfortunately. And then there's also primary sclerosing cholangitis, which is basically inflamed bile ducts. And yeah, it's sort of showed on the right what the last two are. And then also just other conditions in general, not autoimmune, but just general conditions. This includes like paranoia, depression, epilepsy, myopathy, and osteoporosis, which is even what I mentioned earlier, vitamin D and calcium in terms of deficiencies. And then there's infertility. So treatment. Unfortunately, no drugs can actually treat celiac disease, but you can go on a lifelong gluten-free diet. And this is actually the best option you can possibly do. Not because it's the only option. Well, it is the only option. But anyway, this is because it basically cures the disease. But however, if they continue again, unfortunately their symptoms are going to come back. And they will have a relapse. Anyway, yeah. But you also must keep in mind that grains always have gluten. So this includes like wheat, barley, malt, etc. Now, there are even processed foods with gluten, so you have to be careful. Sometimes they get sneaky with it. So like this includes like granola bars, potato chips, French fries, soy sauce. So incidence. So on estimation, around roughly 1 in 133 Americans, basically 1% of the population, actually have celiac disease. Now, recent screenings though sort of point to sort of a higher potential in amount of Americans in prevalence. They're even higher than 1% in the United States. So as you can sort of see on this map, the darker it is, the higher it is. So in America, it's actually still on average roughly 1%. It could be higher, but it's sort of like broad ranges. It's higher in Australia, and also in some parts of Africa. And but a mass screening program of children in actually Italy, so right there, like the little boot right next to there, it found that the prevalence of celiac disease is around 1.6, and it's actually like 1.4 worldwide. So really, it's the average of those two, basically. Now, there was a study of around 50,000 people with celiac. Sadly, around 6,600 of them ended up dying after an average follow-up of 12.5 years. So a median of 12.5 years they met up, and unfortunately they were dead. But yeah, so in the vast majority of cases, though, it's actually not fatal. And unfortunately, it does seem to lower your lifespan, though, if you do have it. So complications. Vitamin deficiency, as we've mentioned on that one slide, anemia, you sort of get the gist of that from that slide and a couple others. Osteoporosis from calcium and vitamin D deficiency, ulcerative jejunitis, which is basically part of the small intestine being negatively affected, and enteropathy associated T-cell lymphoma, which is basically a type of lymphoma in the intestine. So now these are what happens if it's left untreated, though. These are complications. And they can actually be quite severe, surprisingly. And we're excited. Thank you.